What if your body has been trying to warn you about rising blood sugar, and the signs are so quiet you could mistake them for just getting older, being tired, or having a busy week? That happens more often than people realize. High blood sugar does not always arrive with a loud alarm. Sometimes it shows up in small, everyday changes that seem harmless at first. A little more thirst. A little more fatigue. A little more trouble seeing clearly. And here's the part many people miss. When you notice these signs early, you may have more time to talk with your doctor, review your habits, and protect your energy, your balance, your sleep, and your long-term health. So stay with me, because one of the most overlooked signs often shows up at night, and another can feel like a normal part of aging when it really is not. I'm Dr. Amelia Watson, and if you've been wondering whether your blood sugar may be rising, I want to make this simple and clear. This matters because blood sugar affects more than diabetes. It can affect how steady you feel on your feet, how well you sleep, how sharp your mind feels, and how much energy you have to enjoy your day. Many older adults tell me the same thing. They say, "I just don't feel like myself." They are not always in pain. They are not always seriously ill. They just feel off. And sometimes, rising blood sugar is part of that picture. Not always, of course, but often enough that it deserves attention. The first silent sign is feeling thirsty more often than usual, especially if your mouth feels dry and you keep reaching for water, but never quite feel satisfied. Now this is important. We all get thirsty sometimes. A warm day, salty food, certain medicines, and even indoor heating can do that. But if your blood sugar is rising, your body may try to get rid of extra sugar through your urine. That can pull more water out of your body. You may notice dry lips, a sticky mouth, or a feeling that you just cannot quench your thirst. Some people tell me they suddenly start carrying water everywhere. Others wake up during the night feeling parched. That matters because dehydration can leave you feeling weak, dizzy, and more tired than usual. The second sign is going to the bathroom more often, especially at night. Many people brush this off right away. They blame age, a weak bladder, or drinking water too late in the evening. Sometimes those are part of it. But there is another reason. When blood sugar rises, your kidneys work harder to remove the extra sugar, and that can lead to more urination. If you are waking up again and again to use the bathroom, pay attention to what else is happening. Are you also more thirsty? More tired? More hungry? Seeing a pattern matters. One change alone may mean very little. Several quiet changes together can tell a very different story. If this is sounding familiar, let me know in the comments how old you are, or which small change you've noticed lately. I read those comments carefully, and they help me choose what to talk about next. And if you want simple health videos in clear everyday English, please subscribe and stay with me here. My goal is to help you feel more confident, ask better questions, and notice the warning signs many people miss before they become bigger problems. The third silent sign is feeling unusually tired, even after what should have been enough rest. This is one of the easiest signs to ignore because life itself can wear us down. Poor sleep, stress, caregiving, pain, and medications can all drain your energy. But when your blood sugar stays too high, your body may struggle to use that sugar well for fuel. In plain language, the energy is there, but your cells may not be using it the way they should. So you feel worn out, heavy, or foggy. You may wake up tired. You may need a nap you never used to need. You may sit down in the afternoon and feel like your body just ran out of power. Here's the part many people miss. This kind of tiredness is not always dramatic. It can feel like a slow fading of your usual spark. The fourth sign is blurry vision that comes and goes. This can be unsettling, and it deserves attention. If your blood sugar is rising, shifts in fluid levels can affect the shape of the lens in your eye, which may make your vision look less sharp. Some people notice that reading becomes harder by evening. Others say the television looks a little fuzzy, then seems normal again later. This does not always mean blood sugar is the cause, because vision changes can also come from dry eyes, cataracts, eye strain, or other eye conditions. But if blurry vision is new, repeated, or paired with thirst, fatigue, or frequent urination, it is worth mentioning to your healthcare professional. And if you ever have sudden major vision loss, severe eye pain, or new weakness, that needs urgent medical help right away. The fifth silent sign may surprise you. It is feeling hungrier than usual, even when you are eating enough. People often expect high blood sugar to reduce appetite, but sometimes the opposite happens. If your body is not using sugar well, you may feel like you need more food, more snacks, or more carbohydrates just to feel satisfied. A person may eat breakfast, then feel hungry again much sooner than expected. Or they may notice stronger cravings in the late afternoon. That does not prove anything by itself, but when it shows up with the other signs, it can be an important clue. And this is where people sometimes get stuck. They feel tired, so they snack more. They feel thirsty, so they sip sweet drinks. They feel hungry, so they reach for quick foods. Without realizing it, they may be feeding the very cycle that is making them feel worse. Now let's talk about one of the most practical things you can do. Start noticing timing. Not just symptoms, but when they happen. Do you feel shaky, sleepy, or extra hungry after certain meals? Do you wake up thirsty at night? Do you feel your energy crash in the afternoon? A simple note on paper can help more than people expect. You do not need to obsess over every bite or every hour. Just notice patterns. That can help you have a much better conversation with your doctor, especially if you are worried about prediabetes, diabetes, medication side effects, or changes in your daily routine. And if you already have diabetes, do not stop or change your medication on your own. A medication review, done safely with your clinician or pharmacist, is the smart way to handle concerns. There are also a few common mistakes I want you to avoid. The first is assuming every symptom is just age. Getting older does change the body, yes, but not every new problem should be waved away. The second mistake is waiting for very obvious signs before taking action. Blood sugar can rise quietly for a long time. The third is trying extreme diets, miracle supplements, or internet fixes that promise fast results. Please be careful with that. If you take medicine for diabetes, blood pressure, kidneys, or the heart, sudden changes in diet, pills, or supplements can create new problems. Small, steady steps are safer. Drinking enough water, choosing more balanced meals, moving your body in ways that fit your ability, and getting proper testing when needed are much wiser than chasing quick cures. Let's make this even simpler. If you have noticed 2 or more of these signs, more thirst, more bathroom trips, unusual fatigue, blurry vision, or stronger hunger, it may be time to ask your doctor whether your blood sugar should be checked. That conversation is especially important if diabetes runs in your family, if you carry extra weight around the belly, if you have high blood pressure, if you are less active than you used to be, or if you have had prediabetes before. And there are a few red flag symptoms I never want you to ignore. If you have severe confusion, fainting, chest pain, trouble breathing, sudden weakness, severe dehydration, or vomiting that will not stop, get medical help right away. Those are not symptoms to watch at home. The good news is that early awareness can give you back a sense of control. Rising blood sugar is not something to panic about, but it is something to respect. The body often whispers before it screams. And when you learn to notice those whispers, you can act sooner, ask better questions, and make safer choices. Sometimes the next right step is as simple as booking an appointment, taking a symptom list with you, and saying, "I've noticed a few changes, and I want to check what's going on." If this helped you, please share it with someone you care about, especially a parent, partner, or friend who has been saying they feel tired, thirsty, or just not quite right lately. And tell me in the comments which signs surprised you most. I'd love to know what you want me to cover next. Until then, take care of yourself, pay attention to the small changes, and remember this. Your body is not bothering you. It may be trying to protect you.